My name is Dr. Soumya Singh, and I'm currently working as a junior clinical fellow in general medicine in the UK. I am presenting a presentation on anti-obesity medications. So, before I come to the medications, I'll be talking about in general what obesity is and the prevalence of obesity and what are the problems that can be caused because of obesity. So, obesity is defined as an abnormal or excessive fat accumulation that poses a risk to the health. Now, how do we know if a person is obese, overweight, underweight, or is in the healthy weight range? The first thing that we see is BMI, which is body mass index. Body mass index uses two criteria basically, which is your weight and your height, to see if your weight falls in the normal range for your height. If your body mass index is more than 25, which is categorized as overweight, but if body mass index is more than 30, it is categorized as obesity. That is a more serious, and it is something to be really concerned about. And even if you're overweight, I think it's important to try to reduce the weight so that you don't fall in the margin of obesity. Now, coming to how common obesity is and why I'm actually talking about this topic. So, obesity is increasing at an exponential rate in today's fast-paced world. Especially in developed countries, it is really high. Coming to the ranking, the first country which has the highest percentage of obese people is American Samoa, which has about 70% of obese people in the country. Second one being Nauru, and third one being Tokyo, with very marginal differences in the percentage of people who are obese in these countries. The country on the 10th rank is United States, which has 41.64% of people who are obese. Now, why is obesity an issue? Obesity can cause a lot of health problems. The first one is the long-term health problems that it can cause, like type 2 diabetes mellitus. Now, what exactly is type 2 diabetes mellitus? It basically means that the blood sugar level in your body is high. So, it is more common in people who are obese. Second one being hypertension, which is high blood pressure. Third one being stroke, which basically means the supply of blood to one part of your brain is stopped. This is very common in people who are obese and less common in people who come in the healthy weight range. It can also lead to heart diseases like heart attack, heart failure, and angina. And it can also affect your liver by causing fatty liver disease, which leads to deposition of fat in the liver. This deposition of fat in the liver can lead to severe liver damage, cirrhosis, or even liver failure. The last one being kidney disease. It can also lead to things where like acute kidney injury or chronic kidney disease. And even it is interesting to note that if a patient who is obese develops type 2 diabetes mellitus, can also have kidney disease as well, because it can be through diabetic nephropathy. So all I'm saying is, when you see all the long-term health problems, they are all interrelated. Like people who are obese can also have all these issues like heart problems, liver problems, kidney diseases, diabetes. So it's very important to tackle obesity so that all the long-term health problems can also be prevented. It also increases risk of cancers like meningioma, multiple myeloma, thyroid cancer, breast cancer, cancers of GI tract, endometrial and ovarian cancer. Can also lead to a few breathing problems like asthma, which basically means that your airways are getting narrowed and it's difficult for a person to breathe who has asthma. It is more common in people who are obese. Second one means sleep apnea. Sleep apnea basically means that whenever you are trying to sleep, you're not able to breathe properly, which leads to things like snoring and excessive daytime sleepiness. Sleep apnea is very, very common in obese people. The third one being infertility and sexual function problems. It has been noticed that patients and women who are overweight often find it difficult to bear a child as compared to women who are in the healthy weight range. It is also seen that people and males with higher BMI have more sexual function problems as compared to people who have normal BMI. The last but not the least, and often overlooked, are the mental health problems that it can cause. People who are obese often have low self esteem, they feel less confident, they suffer from mental health issues like depression and anxiety, they usually try to stay alone, and they feel like everyone's mocking them. So it's very important that obesity also leads to mental health problems, and that is something we need to tackle. So, obesity, as in the long term, leads to health problems. It also increases the risk of cancers, also leads to breathing problems and infertility, but it can also cause some mental health issues. Now, how we can overcome this health problem? There are various ways why we can tackle this health issue. The first one and the most commonly used is the lifestyle changes. So, we can try to have good diet, like increase the intake of protein, increase the intake of vegetables and fruits as compared to fats, as compared to fried foods. So, dietary modifications are very important. Along with that, there are tailored exercise programs that you can enroll in, starting from getting a gym membership or maybe having a personal fitness trainer who can help you in overcoming this problem. Third one being weight loss medications. Now, there are a few pharmacological therapies that can also help in losing weight. And the last one being surgeries. So, there are weight loss surgeries as well, also known as bariatric surgeries, which are commonly used to lose weight nowadays. In this presentation, I'm going to basically talk about the anti-obesity medications, that is, the pharmacological therapies to overcome obesity. The first medication is semaglutide. Now, semaglutide is also known as Wegovy or Ozempic as the brand name. Semaglutide is a GLP-1 receptor agonist. It works by decreasing the appetite, increasing fullness, and increasing satiety. It was approved by FDA in 2021 to be used as an anti-obesity medication. Semaglutide is injected as an injection and is approved for use in adults and in children who are 12 years or older with severe obesity. The dose is gradually increased over a period of few months to arrive at 2.4 milligram dosage. Now, there are a few side effects of semaglutide, like nausea, diarrhea, vomiting, and constipation. But there are a few serious adverse events as well, like hepatobiliary disorder, GIT disorder, and mild acute pancreatitis. It is very important to note that this medication is contraindicated in patients who have a family or personal history of medullary thyroid cancer or MEN2 syndrome. The second drug being tirzepatide, which is sold in the name of Zepbound. So this medication is a first-in-class dual agonist. That is, it works on two different receptors, that is GLP-1 receptor and glucose-dependent insulinotropic peptide receptor, that is GIP-1 receptor. So it works on both the receptors. It is administered once a weekly subcutaneous injection. Now, how does this medication actually works? It basically decreases calorie intake, it increases glucogen and triglyceride uptake, and also increases insulin sensitivity. The additional benefit of using this drug is that people have noticed that it leads to a decrease in your blood pressure, basically systolic blood pressure, diastolic blood pressure. It also helps in controlling HbA1c levels and also helps in controlling LDL, HDL, and triglyceride levels. So this is a dual benefit drug basically, which will help in controlling obesity, but also helps in other conditions like high blood sugar, high blood pressure. Now, there are a few side effects of this drug like nausea, vomiting, diarrhea, and constipation. A very important caution to be noticed and not ignored is that it decreases the absorption of estradiol containing oral contraceptives. So, in women who are taking contraceptives which contains estradiol, and if they want to take tirzepatide, it will reduce the effectiveness of their contraceptive and they might become pregnant when they don't want to. So it's very important to take another contraceptive method when you are taking tirzepatide, so that the effect of your contraception is not reduced. The third drug being phentermine. It is sold under the brand name of Adipex and Suprenza. Now, phentermine is one of the oldest and most widely used weight loss medication. How does this medicine actually works? Now, this medicine is basically an adrenergic agonist that increases the release of norepinephrine. Norepinephrine leads to reduced appetite and increased resting energy expenditure. Now, what does increased resting energy expenditure means? It basically means that even when you are resting, your metabolic rate is high and you are burning fat. So it works in both the ways. But there are a few side effects of this medication as well, like dizziness, dry mouth, insomnia, palpitations, diarrhea, and constipation. It also interacts with a few medications like MAO inhibitors, also interacts with alcohol and anesthetic agents. So if you are taking any of these medications, you might not be able to take phentermine and you might have to switch to a different medication. Now, there are a few contraindications as well. It also leads to uncontrolled, it should be prevented in patients who have uncontrolled hypertension or who have cardiovascular disease history. The next one being Orlistat. Orlistat is also sold under the name of Zenicalin Ally. It is a lipase inhibitor, that is, it blocks the enzyme lipase, which works by blocking this enzyme and breaks down the fats consumed by food. So lipase is basically an enzyme that breaks down food and converts into fat. So when this enzyme is blocked, the breakdown of food into fats is also stopped, so the absorption of dietary fats is reduced. Now, there are a few side effects that come with this medication, like steatorrhea, diarrhea, flatulence, abdominal pain, and it also increases the risk of osteoporosis by decreasing the absorption of vitamin D and calcium. It can also increase the risk of acute kidney injury and should be used in caution with patients who have anorexia or bulimia nervosa. Next medication being naltrexone and bupropion. It is a combination medication sold under the brand name of Contrave. Now, these are two different medications. So I'll be talking about both the medications, how they work, and how we can use them to overcome obesity. Naltrexone is an opioid receptor antagonist. It is widely used for the treatment of opioid addiction. Naltrexone is used to control obesity because it reduces food consumption by blocking beta endorphin action, as well as preventing autoinhibition of pro-opiomelanocortin neurons. So it basically helps by controlling food consumption, because when it blocks the action of beta endorphin, it will help in reducing your hunger and you won't feel hungry that often. Second medication being bupropion. Bupropion is a norepinephrine dopamine reuptake inhibitor. It is used in the treatment of depression, seasonal affective disorder, and is also used for smoking cessation. So this medication basically came in the market to help in psychiatric problems and in smoking cessation. But how this combination works to control your hunger and to overcome obesity is not generally clear. But it is actually believed that naltrexone affects the neurological reward pathway in the brain, while bupropion suppresses the appetite. There are a few side effects of this drug combination. It can lead to nausea, constipation, headache, vomiting, insomnia, dry mouth, and diarrhea. Now, as we saw a few medications which were used for weight loss, now I'm going to talk about which medications are actually effective and which of the medications have the highest effectivity rate when it comes to weight loss. In 2022, American Gastroenterological Association released recommendation for weight loss medications among patients with obesity who do not respond to lifestyle interventions alone. The first four-line options are semaglutide, liraglutide, phentermine topiramate, and naltrexone bupropion combination. Semaglutide has been shown to be highly effective in losing weight as compared to other medications. But I'll again pinpoint the fact that it always starts with the lifestyle modifications first and then to the medications, and then to the surgeries. Now, a very important issue is that once you stop taking this medication, it can actually lead to weight regain. So it's important that we try to control that weight gain after stopping the medication. Because what happens during this, when you take these medications, is that your appetite is reduced and your metabolic rate is high. It is because of the medications that you are having a high metabolic rate and reduced appetite. But once you stop taking the medication, all of a sudden your hunger can increase, which can lead to an increase in weight. So, weight loss medications can be continued for a longer period of time only after the advice of a doctor and not by the patient alone. So, it's important if the clinician and the patient both feel that it is important to maintain the weight loss plateau and prevent weight gain. So, the weight loss medications can be continued in that particular situation. Lastly, treating obesity is a big challenge in today's fast-paced world, and it's it's difficult for people to have a healthy lifestyle, to do everything that's important for their body when they have so much stress. But it is very important to overcome this disease, as it can lead to a lot of health issues, as I talked about in a previous slide, that it can lead to long-term health problems, also mental health issues. So, with the combination of lifestyle modification and pharmacological therapies, treating obesity is something that can be dealt with. This will also decrease the incidence of stroke, cardiovascular disease, and sudden cardiac death. But again, it's important to note that pharmacological therapies alone cannot help if lifestyle modifications are not implemented. So, if the patient is not able to lose weight by lifestyle methods and wants to lose weight by pharmacological therapies, also needs to implement lifestyle measures. That's it for my presentation. Thank you.